Hi, Dr. Cline here. This video is intended to help go over post-op discharge instructions for your dog or cat's spay procedure that they had today. So when you pick up your pet today, you will notice that they have an area shaved on their arm where they had an IV catheter. We use this to help administer fluids during surgery and also IV anesthetics and drugs that they need throughout the procedure. So there will be a little shaved spot there. When dogs and cats get spayed, they're gonna have a small incision on their abdomen. And with cats and dogs, we do go full thickness through the skin and through the muscle. And so that incision that they have on their belly is going to take a full 10 to 14 days to fully heal. So it is really critical in the post-operative period that they are resting at home and not too active. So for cats, I think trying to confine them to a smaller room, potentially in the house, so that they can't get the zoomies and run around and kind of up and down off of cat trees is ideal. I know it can be harder to keep cats confined, but being able to keep them in a small room or bathroom can be helpful with that post-operative period. For dogs, if they're crate trained, that's perfect. Otherwise, also trying to confine them to a smaller area in the home, and so that they can't run up and down the stairs or just around the house kind of at their own free will. When going outside, we need to stick to leash walks only to go out and go to the bathroom and then back inside resting. We don't want to do any long walks or any kind of off-leash time. No running, jumping, or playing with other pets during this time either. It is very normal for there to be a little bit of redness around that incision, maybe a little bit of minor swelling, but truly if you do notice any significant swelling, really bad bruising, any bleeding, or if you're concerned that the incision could have opened up or become infected, anything you're worried about, please reach out to us. If we're open, certainly we'll see them and try to get them in so that we can evaluate that. If it is an after-hours situation that you feel like is more urgent, then we have a lot of great after-hours hospitals in Charlotte that can certainly evaluate your pet. All of the stitches are going to be on the inside, and so those will dissolve on their own. They don't have to come back to have anything removed. It's just really important that we are monitoring that incision daily for, again, any signs of infection, and also that they don't lick the incision. So your pet will go home with an e-collar or a cone today that they do need to wear for the 10 to 14 days while that incision is healing. A lot of pets don't do very well with the donut collars because they're able to kind of get around that and still lick at the incision. I have some owners that prefer to do the pseudocools that you can put on them to kind of cover up the incision. We have to be really careful with those as well because some pets are still able to kind of move that fabric over and still get to their incision and lick, and truly it can be a matter of minutes for them to either open up an incision fully, and then we're having to consider if we need to go back into surgery. I've seen incisions get infected really quickly after just a couple of minutes of licking, and so the e-collar that we send home is going to be the best thing to prevent them from getting to that incision. It needs to stay on at all times, especially at night or when they're not being supervised is the most common time when pets are going to start licking. You can offer your pet some food this evening, and so they may or may not want to eat. Every animal is a little bit different after anesthesia, and if you offer some food tonight and they're not super hungry, I'm not too worried about that. I would expect their appetite and attitude to be pretty much back to normal by tomorrow morning. Some pets that may be a full 24 hours before they're back to normal, but if you have any concerns about appetite at all, let us know. It is also not uncommon for them to maybe not have a bowel movement for the first 1 or 2 days after anesthesia. If you have any concerns there as well, please just let us know. Your pets will be going home with some post-op medication. Often that's going to include some type of pain control, usually a non-steroidal anti-inflammatory medication, and then potentially sedatives to help keep them calm if that's something that you have requested. And so at discharge, our technician or assistant going over the discharge instructions will go over all of your post-op medications for at-home use. That will be kind of very specific patient to patient, but we're happy to answer any questions that you may have. I would wait a full 2 weeks before doing any kind of baths. We definitely don't want your pet to be submerged in water, so no kind of bathing or swimming for a full 2 weeks. We don't really need to see them back for a post-op recheck, but if you have any concerns about the incision, or if you'd like to have them come back in at the 10 to 14 day mark for us to take a look and just make sure that they're cleared to kind of go back to normal activity, we are happy to see them back for that. The big things that I want you to watch for at home, kind of in the first 12 to 24 hours after anesthesia, when you take them home this evening, it'll be very normal for them to maybe be sleepy, but if you feel like they are extremely lethargic, if you notice any pale gums or acute weakness, any bleeding or significant swelling is going to warrant an emergency visit this evening, and so just watch really closely for any of those signs. Otherwise, your pet should recover well within the next 10 to 14 days, and after that period can kind of go back to their normal activity and lifestyle. And so if you have any questions, please feel free to reach out to us and let us know.